Hey everyone, Dr. Josh Matson here with Infinity Chiropractic Center. I'm going to talk about ear infections today. We see a lot of kids that have chronic ear infections, and I'm going to talk to you guys about what we see most often contributes to these, what we do to help them, what you guys can do at home to help these kids, and go from there. So, ear infections. I'm talking about inner ear infections where fluid just isn't draining well, and the reason why is so kids' ear canals are what they're supposed to be is they drop down like this that allows things to drain. But in kids, they're not very steep in a lot of cases, and then fluid can get stuck in there and not drain appropriately. There's multiple reasons why. A lot of times there's muscles in there that should contract and open to allow fluid to drain. It's called the tensor veli palatini, I believe, or something like that. I can't remember off the top of my head, but that nerve comes out of your vagus nerve, which comes from your brainstem. And I'm going to explain why that's important here in a second. But so this issue we tend to find starts at a very young age, right? Actually, the issues start from birth. So about 80% of the time, research shows 80 to 90% of the time, actually, kids have misalignments in the upper part of the neck just from a normal natural birth. There's about 25 pounds of axial traction with rotation during a normal birth. Infants don't have muscle tone developed well enough to stabilize their upper neck during that, and it creates a dysfunction. And that's important because, or the reason why that's important with this is it limits their movement and doesn't allow them to have good, solid range of motion. Every single kid that I check that has that they're not draining well, their neck does not move efficiently at all. And that's important because when you move, when your body moves, when your body and your neck moves, that allows you to helps you to drain fluids through your lymphatic tissue, and allows that motion is super important to help you drain. Also, movement helps you develop your brain stem, which helps you develop your vagus nerve, which allows that muscle to function appropriately in your inner ear. So that's super important. But also, there's a reflex that I find in literally every single case of ear infections I've ever seen. It's called an asymmetrical tonic neck reflex. It should go away right around 6 months. It helps kids learn to crawl, helps you develop hand-eye coordination, but in a lot of kids it doesn't develop appropriately, and that limits their range of motion. And actually, whenever they turn their head to one side, they actively contract the muscles on the opposite side of their body, which increases muscle tone through their neck, and again, further creates that inability for them to move efficiently and to get good ranges of motion that allows them to drain that fluid. So that's the biggest reason why kids get chronic ear infections, because they can't drain that fluid, then it gets infected. So what you need to do with these kids is you need to get them moving appropriately. And you can, if you know a child that is struggling with this, I mean, literally take their head and try to turn it. You'll see they literally can't turn their neck efficiently at all. It's super tight. All the muscles in the back of their neck are super tight, but they need to be nice and loose so they can get full ranges of motion, move appropriately, develop their motor skills, and also to drain fluid efficiently. So test that in your kids and see if that's there. Another thing, dietarily, probably the biggest thing that affects kids that I find, and something that helps a lot of times, is just taking dairy out of their diet. So if they're on formula, it is a dairy-based formula. That helps a ton to get that out, because that increases inflammation, which your eustachian tube is a tube. If you get inflammation in there, it's going to further decrease the ability for anything to drain out of there. And it just creates congestion. It creates sinus issues. It can create chronic sinus infections if kids have, because a lot of kids have sensitivities to it. So I hope those things help you guys. Number one, get them moving. If that doesn't make a change, try changing their diet. Typically, dairy is a big thing for them. And if you guys have any questions, let me know. If you guys know anyone that needs help, send this video to them. A lot of times, adjustments mixed with some movement exercises improves the range of motion in their neck and allows them to start draining really efficiently. So have an awesome day, and we'll talk to you guys soon.